I'm Dr. Lisa Radosta, a board-certified veterinary behaviorist. Don't forget to like and subscribe if you like this video and you want to see more like it. Have you ever given a medication to your cat or your dog to change their behavior and they've had side effects, so you had to discontinue it, or you gave the medication like the doctor said and it didn't have any effect at all? Well, you're not alone. I've seen dogs go from aggressive to calmer and cats go from fearful to cuddly with the help of behavior medications, but only when they're used correctly. Today I've got the top 5 mistakes that veterinarians and pet parents make with behavior medicines that cause them to fail. Mistake number 1, incorrect dosing. So the thing about behavior medications that makes them different than, let's say, non-steroidal anti-inflammatories or antibiotics is that we don't really have an exact dose we're trying to hit to have an efficacious drug. In other words, sometimes I can give the same medicine, let's say trazodone for example, to a dog at a very low dose and the dog is completely sedated. I can give the medicine at 4 times that dose to the same size dog and they're bouncing off the walls, right? And so behavior medicines generally are going to be started low and go up. If the veterinarian is not familiar with the dose, or you are too concerned about the medicine to actually give it at the dose that's recommended, it's not going to work. So give the medication at the right dose for that medication if you want it to work, and understand that the medicine will have to be tweaked for that particular dog or cat. Mistake number 2, unrealistic timeline. Okay, antidepressants take 4 to 6 weeks to work, period. And sometimes at the 6-week point, we have to change the dose again to get it to work. So it could take you 3 months before you really see the effect from an antidepressant. And remember, mistake number 1, if it's not the correct dose, it's not going to work no matter how long your pet is on it. Short-term medicines, like let's say trazodone or gabapentin, do work more quickly, but trazodone is one of those drugs that can take up to 5 hours to work. So again, if you're giving it an hour before an event, it's probably not going to work for you. So make sure that you and your veterinarian understand exactly how long it takes for a medicine to work in your particular species, cat or dog, whether it needs to be given with food to work more quickly or whether it will work less quickly with food, and how often that dose is going to have to be changed before you should see an effect. Number 3, unrealistic medication expectations. If medications cured behavior problems, we would all be living in a utopia where everyone was happy because we'd all be taking these behavior drugs. Look, it's not only the drug, it's all the other things that you do. So what can you expect from medicines alone? I call a medication effective or a success if it changes the behavior by 50%. What do I mean by that? I mean the animal is 50% more resilient. Recovery time from a stressor is reduced by 50%. Intensity of the behavior or frequency of the behavior is reduced by 50%. That's considered a success. Okay, so if you are expecting some magic cure from medication, you are going to be disappointed. Mistake number 4, over or under reacting to side effects. I have had clients wait a month to tell me their dog isn't eating well and the dog has lost 5 pounds. And I've also had clients discontinue medication because their dog sneezes once. All right, so the most important thing is that communication with your vet. It's asking, what are the side effects? If your veterinarian doesn't know, it's perfectly reasonable for them to call a specialist or to refer you to a board-certified veterinary behaviorist that knows these side effects well. If you see any side effects, you want to call your veterinarian immediately, right? So that they can work through those side effects with you. Mistake number 5, starting medication without doing anything else. Sometimes pet parents come to me and they say, I'm going to wait till my dog is less anxious, so I'm going to give the medicine, and then when he's less anxious, I'm going to start the behavior modification. No, I don't think so. A complete plan is going to possibly include all of the following. A complete medical workup. Actually, you should always have that, period, end of story. But number 2, medication if your pet needs them. Could be changes in diet or supplements. Behavior modification if you so choose. Environmental changes, which means reducing your dog or cat's ability to display that behavior in the first place by modifying the environment. It isn't always possible for every single family to implement all aspects of a complete plan. That's cool, right? That's fine because you have to work within the confines of your life and your budget. However, your expectations need to be realistic that if you're only giving medicine, you're probably not going to see a significant change in your pet's behavior. So the things that are non-negotiable for every single behavior patient is a medical workup. That has to happen. Whether or not you feel it's not medical, that workup is non-negotiable. The second thing is changes to the environment. These are low cost or no cost, and they reduce the chance of behavior very, very quickly. They're extremely effective. Those are things like instead of walking your dog outside, if your dog is a reactive dog, you are walking your dog in the backyard or playing with your dog in the backyard for exercise, or you're using some way for your smaller dog to eliminate inside if you're in a high rise, right? It's that kind of thing. So let's recap the top 5 mistakes you or your veterinarian have probably made with behavior medications. Number 1, incorrect dosing. Unrealistic timeline expectations. Number 3, unrealistic effect expectations. Number 4, under or overreacting to side effects. And number 5, starting medicines without doing anything. If you and your veterinarian can avoid these top 5 mistakes, you will see a big boost in how well these medications work for your dog or cat.